When Megan Bogue first began to feel numbness and tingling in her legs after her routine walks, she thought nothing of it. As the numbness increased and the strength in her arms began to decline, she noticed the simplest of tasks, like slipping her hand into her back jean pocket and brushing her hair, had become a challenge. This is when she knew this was something she could no longer ignore. A few months later, at the age of 40, Megan was diagnosed with an unpredictable and complex disease, multiple sclerosis, or MS. A disease she soon learned could have a significant impact on every aspect of her life: emotional, cognitive, ability to work, mobility, and most of all, her independence.
When the doctor diagnosed me with MS, not knowing much about MS, my fear was that I would be having to depend on other people for the rest of my life. I'm a very independent person, and the thought of having to rely on other people for day-to-day things was not acceptable in my head. And I was absolutely terrified that I would end up in a wheelchair and dependent on other people.
Megan is not alone. In fact, Canada is known for having one of the highest prevalence of MS in the world, with an estimated 55,000 to 75,000 people living with the disease. MS is a debilitating disease of the central nervous system, or CNS, that attacks the protective covering, or myelin, of the brain and spinal cord, causing inflammation and damage. This damage can lead to symptoms such as loss of balance, incontinence, vision problems, and cognitive and emotional problems. This MS Awareness Month brings new hope for people living with this devastating disease, as a new first-line oral therapy for the treatment of relapsing, remitting MS, Tecfidera, formerly known as BG12, is now available. Dr. Marcello Kremenchutsky is a London-based neurologist, director of the local multiple sclerosis clinic, and one of the lead clinical researchers. According to Dr. Kremenchutsky, Tecfidera is an important addition to the MS treatment landscape.
This new oral treatment has significant clinical benefits, starting from the convenience of the oral administration and following with what has been proven in scientific clinical trials to reduce the frequency of the relapses and the accumulation of the disability that is a consequence of those clinical relapses.
Megan began taking this new oral treatment through a clinical trial her doctor enrolled her in. Today, 3 years later, she's living well and managing her disease.
My life has improved with Tecfidera. I've been on it for 3 years now. I haven't had a number of relapses that I had had before. I've not had the numbness and the tingling. I'm able to walk with my friends on Saturday mornings like I used to. I can play with my grandchildren for a longer period of time than I could have before, maybe. Doing the day-to-day housework, the gardening, I just have a little more stamina than I had before.
Early and continual treatment can help patients like Megan live well today and optimize their quality of life in the future. While there's no cure for MS, patients do have access to more treatment options to help them manage the symptoms and progression of their disease. Speak with your doctor to determine which treatment is right for you.